Hi, this is Strix. This is about perception and vision, about how much you understand affects how much you see. And if you're a coach or a therapist of some sort in the mental health space, this will help you take care of your patients or your clients better, and in the very least, avoid getting them into bigger trouble than they're already in. Hopefully, this helps you become a better person and become a better helper for people who could otherwise genuinely really use some help. So, what does this sound like when you hear that a person is moody, extremely tired, could have gained weight significantly recently, has muscle aches all over, extremely fatigued, kind of slow? So you're looking at that constellation of things. So you think it's fatigue, easily tired, really moody, kind of low bat, so to speak, foggy head. A lot of people are thinking depression, and if you look at some of the symptoms, it'll look like it ties into depression. But I was describing someone with a slow thyroid, with hypothyroidism, slow thyroid function. So there are other things that go with that. You can have dry hair, loss of eyebrow hair, a puffy face. There may or may not be a large thyroid. You can have recent significant weight gain. You may not be that tolerant of cold, like you'd shiver almost to death in a movie house. You can have really dry skin. You might have constipation even though you tried desperately to exercise. You might be extremely fatigable, very moody, might have muscle aches all over very often. Your heartbeat might feel slow or weak or irregular. You might manifest the entire slew of symptoms we associate with being depressed, and to boot, you might seem a little slow, and you may have been trying to conceive a baby, but you've been unsuccessful at it. So this entire set of things is part of the cluster of things you'd expect with hypothyroidism. I wasn't describing depression or anxiety, and yet most therapists with a new tool, well, of course you look at things through the lens of your new tool, and if you don't know any better, you think it's what you think it is. This is natural. It's not your fault. It's your lack of exposure and experience, and you may even have been trained to overreach, to believe that you could handle virtually everything, or you may have been marketed to in a way that, well, a lot of the stronger marketing says that here's what your doctor doesn't know, the 3 things your doctor knows but won't tell you, the 3 things that your doctor can't help you because he doesn't understand. The marketing is negative because we pay attention to the negative. Truth of the matter is, more often than not, your doctor is actually on your side. And going back to perception and vision, it really helps to understand that you may not see everything, and that enables you to see more. The delusion that you understand and know everything keeps you from seeing what's actually happening right in front of you. If you have a presumption about what your patient or your client is saying, or what they're trying to say or convey or trying to express, if you have a fixed box of what you think they're trying to say or do, you can't see what they're actually desperately trying to show you but don't know a way of reaching you with, or you've been just too stubborn to hear what they're actually saying. And so it really does help to understand that not everything you understand, not everything at the moment you understand. And when in doubt, it really helps to be part of a team, to be friends with a medical doctor who knows what it's like to work with both body and mind. Because we aren't in charge of everything, but there are particular things which we are really good at, and it helps to stay in your own lane and have a really good, healthy referral system for the stuff you don't completely understand, or that you understand somebody can better help with. So I hope this has been useful. This has been Strix. Cheers.